Good evening and welcome to Money Matters. My name is Charlie Huntington and I am the Chair of Public Relations for Life Sciences PA. Life Sciences PA is the statewide industry trade association and the voice of advancement within Pennsylvania for the life science, biotech, pharma, med device industries. Tonight we continue our special series on life science leaders, but before we do so, I'd like to remind our viewers that from time to time financial issues relating to life sciences, healthcare, and technology matters or companies will be discussed on the show. These discussions are not and should be not viewed without consulting your financial advisor. Moreover, since this program is pre-recorded and shown at a later date, please keep in mind that the information may no longer be current. You should always check with your financial advisor, as I said earlier, before entering into any financial transaction. I'm pleased again tonight to welcome Kimon Hatza as my co-host. Kimon is an attorney and a partner at MillCrest Law in Radnor, and his focus is on life science, healthcare, and information technology areas. Welcome, Kimon.
Charlie, thank you very much. Happy to be here.
Thanks. Can you start by telling our viewers, bring us up to speed with what you've been up to since our last show, please?
Sure. Happy to do that. Thank you for asking. You know that I've lamented both during the show and off camera to you a number of times about how I sound like a broken record in answering that particular question. In particular, I think I look back over the last 2 years, I've probably given you the same answer to that question. And that is, I spend a great deal of my time in the health tech area, and particularly with health information technology. And I've often wondered, am I similar to other lawyers practicing in the area that are in the life sciences space, or is this peculiar to me because I've spent a lot of my career both in the healthcare space and in the technology space, particularly with software companies? And the area is so rich in pharma. You know, I was wondering if I was kind of an outlier. You were kind enough to send me an article 2 or 3 weeks ago from CNBC. And that article made very clear that the hottest sector right now in this industry is the health tech industry in Silicon Valley. As I looked at the article, I was saying, wow, I see a lot of similarities and overlap here. They are literally tripping over each other, looking for people with expertise in the life sciences and technology space to help them make better bets. Help the investment firms, help guide them with the companies that they're choosing to invest in. Among the areas that are the hottest are analytics, which I spend a good portion of my time in, genetics, and also wearable devices. I mean, I don't know about you, but that's already come to the masses. My whole family wears Fitbits and things like. There you go. See, so the industry has spent has invested about $4.2 billion already, and is looking to do more. I mean, people think that it's literally primed for a Silicon Valley type overhaul of this huge healthcare industry. The only complaints I've heard is some of the firms that have been investing in this technology for years are complaining about the novices that are now coming in to invest, because they said they're driving up the prices of some of these companies to internet company type levels. Whether that's going to continue to be a real problem, I don't know. But in light of that, I'm thinking that what I'm doing is probably just in keeping with what is going on, and I would anticipate that my own practice would continue along those lines.
Hopefully, these tech investors will acknowledge that the FDA can sometimes be heavier lifting than just zipping something through Silicon Valley. So
that's certainly the truth.
We'll see what the level of commitment is. Thank you for bringing us up to date with that.
Thank you.
Now, I'd like to turn to tonight's special guest, Dr. David Zuzga. Dr. Zuzga is founder and CEO of Bio Detego, LLC, a platform for early-stage cancer patients to determine the risk of relapse. He's an assistant professor of biology at LaSalle University. Prior to that, he taught at Pace University and St. Joe's University. He has a PhD in genetics, cancer research from Thomas Jefferson University, and got his bachelor's in biopsychology at Vassar College. Welcome, David.
Hi, Charlie. Hi, Kimon. Thanks for having me here today.
Our pleasure.
Can you tell our viewers a little bit about Bio Detego?
Sure. Bio Detego is a early stage cancer diagnostics company. The technology came out of Thomas Jefferson University. It was work that I had a chance to participate in when I was in graduate school there, and it has moved along ever since. We're trying to answer, I think, a very fundamental question and a very difficult questions for physicians and patients. For cancer patients that are diagnosed, have surgery, and that tumor is removed, and there's no other evidence that there's residual cancer in their body, presumably they are cancer-free and are cured of their disease. However, a small percentage of those patients will have their cancer relapse and they'll develop metastatic disease. These patients really would benefit from adjuvant chemotherapy following their surgery, but it's very difficult to identify those patients versus the other ones that are cured of their disease from their initial surgery. So our whole purpose is really to provide physicians and patients with really highly accurate information to identify patients likely to experience a relapse, and also conversely those who are not going to experience a relapse, so that they can make really individualized decisions about adjuvant chemotherapy that will benefit them whether they receive it or not.
When we were doing the preparation for the show, you used an analogy with that included a car's transmission. Can you share with our viewers what the analogy is?
Sure.
I thought that was great.
Yeah, so the test measures a cell mechanism, and this mechanism I compare to a car's transmission. And what our test effectively is doing is looking at a cell and determining whether that transmission is in gear or is in neutral. Now, at the cellular level, what this transmission does is it generates force within the cell. And it literally allows a cell to deform, to change shape, that is integral to the ability of that cell to move, to migrate, to invade and metastasize, to spread throughout the body. And we look at an individual patient's, their normal tissue and their tumors. And we look for changes in the function of this mechanism within a patient using their own normal tissue as a baseline. And the magnitude of change between what we see in their normal tissue and their tumor is what we correlate and is highly associated with disease progression and metastasis.
Okay. And where did the company name come from, Bio Detego?
So the company was co-founded by myself and Gianmario Pitteri, who was a mentor at Thomas Jefferson, and Gianmario is Italian and was really bent on a proper Latin name for the company. And Detego is Latin for to detect, to reveal, to uncover. And it really, I think, is a very appropriate name for our technology, which is really looking to uncover something really imperative about a tumor and a patient's own cancer that could guide treatment decisions.
It's a great name.
David, I recall from our initial meeting that you have two different tests. I was wondering if you could talk about those tests for our viewers.
Sure. So broadly what we want to do is we want to take a group of patients and we want to identify patients at high risk of developing relapsed metastatic disease or low risk. But we figured that there's an opportunity to improve the performance of the test, and also for certain opportunities in the commercialization of the technology that would be provided if we break the test up into two different components. And what we're developing now is an initial test which is optimized solely to identify patients with a very low risk of recurrence. And we would like to offer this test as a kit that is performed in the hospital at a very low cost and provides a extremely high level of confidence that patients that come back negative have a extremely low risk of developing relapse. This will provide physicians and patients with a very quick, inexpensive way to get to the end of the road in terms of their deciding on a treatment decision. Patients that are not excluded from chemotherapy based on that test will then be reflexed into a second test, which is now optimized for both endpoints. It's a more complex test and would be offered in a centralized lab.
Is there a particular cancer that you're targeting at the moment?
There is. So we're focused on colon cancer initially, and in part there are with early detection, we now have non-invasive screening mechanisms and colonoscopies that tend to detect colon cancer earlier. When you have early detection, the problem we're addressing is larger because we're not sure whether or not you're cured by initial surgery. So there's a very large unmet need in colon cancer, and we have some very compelling early data. However, we also have data in breast cancer in a study that we performed with Thomas Jefferson. And interestingly, this cell mechanism, this transmission, is a fundamental part of cells. It's a fundamental mechanism. So it is broadly expressed across tissue types, and in fact, it is expressed in almost universally across different cancer types. So we think there's the potential not only to go into colon cancer, but to many additional cancers where the need for better prognostic information is present. And we also think that as more non-invasive screening tests come on board for cancers such as lung cancer or pancreatic cancer, that then there will be an increasing need for prognostic tests like ours.
Now, is there anybody that's out there in the industry, like do you have competitors that are out there doing something similar to what you're doing?
Sure, there are. Many of the competitors in this space take a different approach. So they typically look at DNA or RNA as their test analytes. Our rationale is quite different. We're looking at protein and functional protein. In effect, we're looking at the mechanisms, the material in the cell that's actually changing the behavior of the cell, rather than DNA or RNA, which are more distal effectors of the state of the cell or the tumor. And we think that this provides a number of advantages that provide a better performance on what we're seeing in early testing.
Are any of these competitors also focused on the colon and colon cancer as you are, or are they looking at other types of cancers?
So a test similar to ours has become the standard of care in breast cancer and addressing the same issues in breast cancer. There are companies who are also looking in colon cancer because there's a very large need, as well as prostate cancer. Again, typically diagnosed early. Unfortunately, many people are diagnosed each year, and those are really the three areas where we see the most activity.
I know you've collaborated with the Mayo Clinic. I'm wondering if you could just take a couple minutes and tell our viewers about that.
Sure. So we received some seed funding in the middle of 2014, and to do some initial pilot proof of concept testing in colon cancer. And we came up with a list of who we'd like to work with. At the top of that list was the Mayo Clinic, a faculty member there who agreed to the study. And we finished up that study last year, and the results were terrific, very, very encouraging. And we're now looking to raise money to expand that into a large clinical study.
Great.
David, do you plan to have your tests covered by reimbursement?
Sure, and that's really the challenge in our space. And in fact, that this two-tiered model that we have, we think is going to position the test for reimbursement. Rather than having a single expensive test, which the competitors are trying to commercialize, we really have a very efficient way where an early test, which we want to price well under $500, that we could even imagine patients being able to pay out of pocket if necessary, but to really try to get many of the patients to the relevant information that they need in a very cost-effective way, and only have a more expensive test for the smaller subsection of patients that aren't excluded based on the first test. And we think that this in terms of health economics is a very novel and we think very innovative approach to this space, and we believe that CMS and other private payers will like the approach.
So how are you presently funding yourself?
So we've received some financing from Ben Franklin Technology Partners, Bio Advance, and more recently from a Phase 1 venture program, which is out of a new fund out of the University City Science Center. And we're now looking to raise a Series A with the Mayo results in hand.
It's great. The first two that you mentioned there with Ben Franklin and with Bio Advance, those are so important because we know many different funding sources that sort of look to get in their jet stream.
Sure.
So that's
And they are really critical, I think, not just to their funding, it's not just critical
right?
to us to validate what we're doing and providing that critical early financing. But I mean, they are regionally, they are the people who are helping out our early stage validating and supporting our early stage community.
So Series A would be a logical next step, and then after that, where do you see, what would be logical after that?
So we hope to perform that large validation study in colon cancer. And we've talked to a number of potential strategic partners who would be very interested in those results. And we believe we'd be in position to partner with an in vitro diagnostic testing company that could help us commercialize the tests. We also think we would be in position to raise a additional round of funding as well as at that point based on the study results.
Tell our viewers about Tony Schubert.
Oh, so Tony Schubert, I mentioned Phase 1 Ventures. And part of the thesis of that program is we're going to match an early stage company with a experienced executive. And we went through last fall that search with Phase 1 Ventures, and it led us to Tony. And Tony was one of the founders, was the chief technology officer at Exact Sciences. And there, Tony invented and developed a non-invasive screening test for colon cancer, which is, you may have seen the commercials for the test on television now. And that has been a enormous success. He went on to found another cancer diagnostics company that went to a commercial stage. And he's really one of the thought leaders in this space. And he came on board at the beginning of the year as our executive chair. He's had a huge impact helping us develop this two-tier model, helping us to identify additional intellectual property that we're protecting. And he's also helping to guide this Series A financing as well.
Once again, you're sort of putting the odds in your favor in terms of validation with these. You're taking smart money, you're hiring smart people, right? I mean, that's the recipe if you can do it. So
right, I'm smart enough to know that I need smart people around me.
It helps. It helps. So, what would success look like for Bio Detego?
Well, at the end of the day, right? If we can develop a test and provide it to physicians and patients and have it make an impact on their lives, in whatever form that may be, that would be success for us. In the near term, we want to complete this large study, and we want to have a validated test.
You are also a professor at LaSalle in addition to being the CEO
Right,
of
correct.
Bio Detego. So I was just wondering how you approach and how you address, serving in both of those roles.
Yes, it is I am a full-time faculty member at LaSalle, and I'm engaged all the time with undergraduate students in the biology department. And I think you manage it by not taking any time off. So the day ends at LaSalle, although the academic, that job never really ends in the course of the day. And in the evenings, you work more on the company. And there's probably never a point in time where I can sit back and say, well, I don't have anything left to do. There's always more to do. But I think also, as I've gone from the academics into this industry, into entrepreneurship, I've learned a lot, and I'm now actually trying to circle back and bring some of what I've learned from the innovation space, from the entrepreneurship, the startup space, back into that undergraduate biology curriculum. And in fact, as a way we've been able to get some synergy between these two endeavors. We've developed a collaborative course at LaSalle, which is we provide in collaboration with the Wistar Institute with Heather Steinman.
Our viewers would know Heather.
Yes.
Yes, she's the head of technology transfer at Wistar. And in this course, we have students travel to Wistar. Heather has put together a curated patent portfolio. They select a technology. They meet with the inventor scientists, spend some time with them to better understand the science. And in the second half of the semester, we bring in some of the regional thought leaders across a number of different spaces, like intellectual property, market research, regulatory affairs, early stage investors. And they build a business plan. And actually, Charlie,
I brought my son Rye down there.
Yeah.
That's right.
at the culmination of the semester, we have a pitch competition, and Charlie and his son Rye attended that. And for me, it's a perfect opportunity to take all this exciting, wonderful, inspiring entrepreneurship experience and bring it into the curriculum with the hopes that we're inspiring and opening doors and ideas for the students there.
Wow, that's a terrific thing for students.
Our viewers will also remember the name Dr. Marcia Timmerman, and I could not believe when I came down and saw you at LaSalle that she was connected with you. You guys were the brain children behind putting this thing together. It was an extraordinary afternoon. Heather was in attendance. There were representatives from some of the local pharma companies. There was I think he's a board member a physician who's done well. So it really went well. The group that won not only had good technology, they could speak well to help sell their technology to the judges. So what you're doing down there, I admire very much, which is not just breeding good scientists, but these are folks who are going to be able to do it in the business world as well, which is great.
Yeah.
So,
Wonderful.
Congratulations. I know our time is short. We have time for one more question and maybe a brief answer.
When we first met, you mentioned your perception of the region as having kind of a Rocky Balboa mindset.
Yes.
And I was wondering for our viewers, if you could talk about that in terms of startup life sciences companies.
Well, like I said, I came from academics without any industry experience when I started Bio Detego. And I have been the beneficiary of so much generosity and enthusiasm and support from our community, our life science community in the region. And I think that across the board, many of us have discussions about what we need to do to get to the next level. Mm-hmm. And I think we have this inherent sense that we're a little bit of the underdogs here. And we have got incredible academic institutions. We've got incredible pieces. But acknowledging that maybe we're underdogs when we look at Boston or Silicon Valley, we're trying to work really hard now to connect all the pieces and get ourselves to the next level. And I think that's something that we experience in the life science space, but I think Philadelphia in many different areas has that mindset and attitude. But it keeps us close-knit and supportive of one another.
Great.
So I want to let our viewers know about our next guest, but before doing that, I just want to say I look back in life at people who've done nice things for me, and amongst the nicest was the invitation to take Rye down and see this thing in action. So that we have a lot of nice guests who come through, but for you to roll out the red carpet, both he and I really appreciated it. So thank you.
It was my pleasure.
Thank you. Good luck to that program. You've been a great guest. Unfortunately, we got to leave it there. We've got enough information, at least for another show, so we're going to need to have you back to talk about how the tests are going and how we're doing in not only with colon cancer, but hopefully this will have applications far beyond that when you guys are successful. So
I'll be here.
excellent, excellent. Kimon, thank you very much for
pleasure.
being co-host. As always, great job. I want to remind our viewers that Robert Milnes, who's a master limited partnership expert, is going to be the next guest on our show. And as always, thank you for watching Money Matters.